Hello, this is Dr. Ray Ramirez from Lakeview Veterinary Clinic, helping your pets live the best life possible for as long as possible. And one of the key ways we can do that is by checking over your pet. So we do a physical exam. We want to do that every year as our pets get older, which is age 50 in human years. So for our kitties, that's if you're 9 or older. For our dogs, if you're kitty size, that's 9 or older. If you're bigger, that can go down to age 7. We want to check twice a year. Feel lumps and bumps, listen for a murmur in your heart or arrhythmia. But then one of the other things we can do is look at some internal organs and how they're functioning. We can do some of that by palpation with our physical exam, but actually doing blood tests are very helpful. And also, a little key thing that's very easy for you to do at home is getting a urine sample. You may be watching this video because we gave you one of these little urine samples. If you don't have one of these, that's okay. We'll show you about that in a minute. But so let's start with how do we catch the urine sample? If you've got a dog, you've got to chase him around with something. So hopefully we get you can use just a little paper plate of something. This one's a little styrofoam one, but you can use a regular paper plate. I would not suggest you use a dish that you eat out of every day. Just a little thought. Even though soap and water cleans that stuff up, just a thought. Anyway, so that, or we can send you home a little tray. You can ask us about that. But catch a urine sample. So you go outside, keep your dog on a short leash, stick this underneath there, we get our urine. On our kitties, 2 different ways. Take some saran wrap, put that on the regular litter. They feel that, and the saran wrap will catch a little urine. We don't need a whole lot. In our little sample here, you can see we've got a fair amount, but really we only need about that much. Only a couple teaspoons is all we really need, and then we can get a good information about that. Okay? So with a kitty, a little saran wrap. Also, we have some little plastic pellets or aquarium gravel you can use in place of the litter. That's not going to absorb the urine, and we'll catch that, and then we can get that sample. So now we've got a sample. What do we do? If you don't have anything at home, or if you do not have one of these, that's okay. Regular little zip top bag, put it in there, or a little cottage cheese type container, put it in there, and then bring that in. If we gave you one of these, this is how this works. Okay? Fairly simple to start with. You just kind of peel this apart, and you'll see a couple little pieces here. Okay, this is like a little straw type thing. This is a little syringe type of case. You just untwist this. It actually is just kind of pushed on, but kind of twisting it makes it a little bit easier. And put the little tip on there, like a little straw. Okay, can you see that? You see this all green thing, it says boric acid. That's a preservative, so you do not have to refrigerate that. We'll come to that in a minute. So we've got this on here, so now we're ready to go. So if you have a little container like this, or a little bit of urine in here like this, we just draw that up. See, now I do this every day, so this is easy for me to do one-handed, but if you're not used to it, you may need to have one hand here, one hand on the little plunger. You're just drawing it up and see how the urine is coming in here. So if it's one of these little fancy gadgets, and as you can see, it's helpful if you tip it or elevate it somehow. If you have someone helping you, that's fine. But you just kind of tip this, and I'm just drawing this up. See, with one hand down here and the other hand here, and we're just pulling this up. And you can see we're getting a nice little sample of urine. As much as you can get is great. Okay? So, and then when you pull that out, just twirl it back and forth so whatever little powder is in there gets suspended. But you can see right here, see the way this little plunger thing comes down here and is kind of angled or is kind of pinched together there? That's to make it easy so that all you have to do is break that off. See? And now you've got a nice smooth edge here. And on this, you can take that off. And then we take our little cap and put that back on, and we're good to go. Okay? And if you receive this from us, you should have a little label on here that has your pet's name and information on there. And so then you just bring this into the to the doctor's office. Again, you do not have to refrigerate this. Bring this in, and we can check for important things like the specific gravity. We can check for early signs of diabetes in this. We can check for early signs of liver disease, as well as obviously kidney disease. Lots of little tips that can be very helpful to check your pet here. And also, we can make sure it tastes great and is less filling too. So, remember, if you don't have a regular veterinarian, go and see him, and if you don't, we'd love to see you at Lakeview, because we're very thirsty and need more drinks.
Okay, we're on.
In case you were wondering what all the background noise was, this is Abe here and Miss Sally, who, as we speak here at the end of April, still need some homes. So, but they were in our studio audience today, and they were upset that they did not get picked, that we used somebody else's pee urine sample. Isn't that true? Okay. I know. Not the whole world can revolve around you, though. No, it can't. No. You still sound like a little ratchet when you purr. You do. Okay, so we got to see how this straw works. Yep, that's okay. You know, did we get the right pee? Because this tastes kind of weird.
See, that's just dog pee.
Oh, yeah. Okay, but see, and then we can take it off like this as we need to do our test with it.